Hello, ladies and gentlemen. Happy to see you again for today's lecture. My name is Dr. Volodymyr Chernykh. For those who do not know me, I'm a medical doctor, dermatologist, and aesthetic practitioner. In today's lecture, we are going to discuss how nutraceuticals can contribute to osteoporosis prevention, as osteoporosis is a huge problem that we have in the world currently, and creating a holistic approach and having more options in our toolbox will obviously help us to fight against this problem and create a better approach for the future generations. So with that, let's start. What is osteoporosis? Of course, it is a chronic, debilitating, progressive, systemic, and sometimes metabolic disease. It's, of course, a major cause of disability in aging populations, like all over the world, for example, like Japan population or any other given aging population. It has obviously different kind of social economic burdens, whether it's high direct burdens, like because of the treatment of those fractures, or some indirect healthcare cost when we are facing some disability, functional disability of any given person. While therapies exist, and we know them, some of them were mentioned, and I will talk about them slightly later, but unfortunately, because of different cultural and socio-economic barriers, there are limits. Also, in certain groups of people, there is a kind of diffuse skepticism for conventional treatments. That is why sometimes we need to zoom out and look for some other options. And that is why currently there is a high demand. This has driven an attention to some nutraceuticals or some let's put it this way, molecules that we can find in the food or nutraceuticals in the supplement that has certain therapeutic potential. Of course, they can be taken as the first-line based therapy, but at the same time, they can complementary treatments, they can go together, they can be as an adjunct therapy. Especially, they can be taken well, seriously as in the early stage of the development of osteoporosis. And due to the natural occurrence, of course, there is a growing demand for taking this particular supplements in some groups of people. All right. And so in today's lecture, we'll look into the major groups of nutraceuticals. We'll discuss what are their strengths, what are their weaknesses, and so I also will show you that there is obviously a lack of standardization of different clinical trials. But anyway, it will once again it will help us to create a positive, friendly, patient-friendly approach for treating and preventing of osteoporosis. When we look at bone, it might look as the lifeless, dense, structure, but of course in the life, it's pretty much alive and a highly dynamic structure with its functions of protection of our body, with the mineral storage, and so on and so forth. And this is highly dynamic organs. Yesterday in my lecture, we discussed the principles of ACM remodeling. It's definitely a highly dynamic organ where cell proliferation, migration, differentiation occurs. And there are a few key cells in this organ. So some of them are like builders. These are osteoblasts. There are cleaners, let's put it this way. This is osteoclasts and osteocytes, the third main type of the cells, which work as the kind of traffic controllers. So they send the signals on where the repair has to start. And in healthy person, healthy individual, this process of remodeling is basically a balance between formation and resorption. But due to different factors like aging or different kind of traumas, of course, there is a disruption. There might be disruption in this process, and that is how we come to osteoporosis. And here is our choice for what kind of strategy we have to choose. So it's whether it has to be some heavy artillery, anti-resorptive, or osteoanabolic agents, or whether we can start as like initial stage, for example, with some nutraceuticals, which I'm going to mention slightly later. So osteoporosis doesn't happen in one night. And of course, there are certain factors that we can possibly that is hard to avoid, like genetics, of course, gender. And so for most of the women, of course, the decline in the bone density mass happens when they lose estrogen, so it happens with the age, and it happens during premenopause and after menopause. And but certain risks, of course, are modifiable. So we are talking about some diets where there is a lack of calcium and vitamin D, or possibly magnesium, when people are abusing themselves with alcohol, smoking, or possibly they have a sedentary lifestyle that also influences the way how they can develop osteoporosis. The emerging risks that we know nowadays, that's different taking of some medications, or whether we talk about proton pump inhibitors, or whether this is steroids or some other groups of medication. It can also be linked to pollution or gut dysbiosis these days, which is, there is highly emerging data about it. And of course, the best prevention, of course, is prophylaxis, and the best treatment is the earlier prevention. However, it is impossible, of course, to start any treatment without those picking up the core lifestyle changes. And of course, it has to be done together with targeted nutrition. And the earlier we start, especially with the risk patient, the better the outcome. We face with the, now let's look how severe and how bad is, like how terrible is the epidemiology and etiology of osteoporosis in the world. So the peak bone mass that we have, we're reaching it by the third decade of life, and then it declines thereafter. So, of course, the biggest, the terrific, and dramatic decline of the bone density in women starts when there is a drop of the level of the estrogen, and that is how we face the primary. That's when we face with primary osteoporosis, type 1, postmenopausal, estrogen-related one. And then the type 2, this is age-related osteoporosis that hits both sex, whether men or women. And secondary osteoporosis is related to, it can be triggered either by disease or drugs or metabolic disorders. Here we have to mention that osteopenia, which is low bone mineral density, is not yet osteoporosis. Well, that's when we don't get the full-blown osteoporosis. However, there is of course, the full threshold is not crossed yet, but there is also a problem. And that's where we are at the risk, high risk of fragility fractions, when when people kind of may have a low impact trauma, when they just like can fall from standing height, and that's obviously a clinical outcome of osteoporosis. And that is not just painful. It creates a high risk of secondary fracture, possibly in 1 year, on a couple of years. So, and overall, of course, the problem of osteoporosis is huge. We talk about 200 million women globally, not mentioning men, and about only 23 million people at high fracture risk are only in Europe. Now, a few words on diagnostic and therapeutic approaches. So the golden standard is still DEXA, so whether we measure it on the lumbar spine or proximal femur. And unfortunately, not in all the developed countries we can do that. So it's either somewhere in Northern America, in Europe, or if you're lucky to have it in your town. It's limited in men. Unfortunately, most of the men, they found out that they have osteoporosis after they get after they get checked by DEXA. But when only osteoporosis had occurred already, or the fracture has occurred, then the other techniques is either quantitative CT or ultrasound or traditional radiography, but they are either less sensitive or they possibly can be expensive, like quantitative CT. So first-line treatments, the backbone of any treatment, of course, this is the intake. Well, this is a correction of modifiable risk, so whether it's nutrition or lifestyle. However, any kind of treatment is just impossible without the baseline support. We are talking about vitamin D and calcium supplementation. When it is not enough, we need to think about the risks, to maximize efficacy, and start with drug therapies. I think quite a few words was said about them. So it's either anti-resorptive or osteoanabolic. So this is up to the doctor what he needs to choose in any given medical situation, in any given clinical situation, after the thorough meticulous evaluation of the patient. So there are no medical practice without some side effects, and so it can be gastrointestinal issues, bone pain, and even some rare risk, even though like when jaw necrosis and atypical fractures are pretty rare, but sometimes that happens. So here, once again, the takeaway is that we need to evaluate every given situation and come up with the particular treatment we need for a given patient. When we think about what are the 6 major nutraceutical categories, we usually combine them into six blocks. So depending on where they come from and what they do. So talking about the minerals first. So of course that's literally the essential building blocks of our bones. So this is calcium, magnesium, phosphorus, zinc, etc. Then we shift to the second group, which shows that's plant-based ingredients, so different kind of polyphenols, herbs that have either antioxidant or anti-inflammatory activities. So pretty much familiar group is, of course, dairy products. They are rich in bioavailable nutrients, but the newer data shows that the content of probiotics in dairy products can work even better. So that brings us to the 4th group, gut-bone axis regulators. And the 5th group, this is dietary lipids. Pretty much familiar to most of you, I guess. This will be polyunsaturated fatty acids, and some of them I'm going to mention. And then promising molecule is melatonin as well. And of course, there are plenty of the others. I'm going to once again to point to the major of them, and going to go with you through some of the major ones. We are not going to touch on them. It's just basically impossible to do within this time frame. So once again, here we first of all, let's talk about the minerals. They're basically, of course, essential blocks, building blocks of a bone. And when we think about them, let's think about them as about like a orchestra, symphonical orchestra, where there is a conductor, where there is a few more members that work synergistically in order to contribute to osteoporosis prevention. And we think about the conductor here. So of course it will be calcium. So majority of people, and most of you, I guess, know that it's a key for bone mineralization. It's regulates the different canonical, for example, WNT pathways for bone formation. It's 90% of calcium in our body. It restores in bones. Then another bone skeleton hero is magnesium. Of course, it's pretty much active in regulating bone cell activity. It's kind of a buffer between inflammation in our body. It also stores the body energy, but here balance is crucial. All right, so too much of magnesium can interfere with bone structure, while too less, when there is not much enough, it's can weaken the bone and disturb vitamin D and calcium metabolism. Phosphorus. So together with calcium, they are structural component of hydroxyapatite, pretty much important. But here, once again, balance is important. Well, there is too much phosphorus, and when there is not enough of calcium, it can also disturb the work of PTH hormone, and then and by that it will pulls out the calcium out of bone and weaken them as well. Potassium, it's reducing calcium loss in what kind of situation? So for those people who kind of create acidic-like milieu or terrain in our body by having a lot of meat, so that will lead to the reducing of the calcium. But since potassium containing food like fruits or vegetables and different greens, they will reduce this calcium loss and support vitamin D activation, which enhances calcium absorption. A few other molecules like iron, minerals, iron, zinc, copper, boron, they also work synergistically for supporting the bone health, for collagen production, and so on and so forth. For example, zinc also, it's kind of stimulate osteoclastogenesis, but at the same time, it regulates osteoblast differentiation. So now here we will talk about the herbs and phytochemicals. So this is, as I mentioned earlier, this is plant-derived compounds, and in most of them they will work through the anti-inflammatory pathways, or they might work as the antioxidants, or sometimes they can work like as the estrogen-like pathways. For example, like genistein, or for example, like resveratrol, which also can work as the estrogen-like pathway. So most of the time, and curcumin will work as like anti-inflammatory agent. So of course, it's like intake of them is like it's case dependent, it's dose dependent, but unfortunately, there are until this moment not that many. There are a lot of animal studies, but not enough of long time lasting human clinical trials for standardization. At the end of the lecture, I will mention on that how we can use this weak sides of, let's put it, of these molecules like herbs and phytochemicals. However, they still can be used as the adjunct therapies in certain cases. And, just for example, resveratrol is not only can be used for the bone health, it's great antifibrotic and helps for longevity and so on and so forth. So basically, it's also great adjunct for bone health, while mentioning the herbs and phytochemicals. All right, possibly one of the most familiar groups is the dairy products and fermented dairy. So yes, they're rich in bioavailable calcium, phosphorus, and protein, and not just because this group as the products is abundant, but it's also all these products, all these minerals like calcium, phosphorus, and even protein, they are highly bioavailable. That is what is good about dairy. And they also contain bioactive peptides and growth factors that our body can have upon digestion. And the newer data suggested that fermented dairy, like kefir, yogurt, they add a probiotic benefit, which is even better. And long time and the consistent taking of the dairy products is associated with higher BMD and reduced, especially hip fracture risk. Then wonderful product that I basically take almost every other day is the cheese, and it is an excellent source of calcium, vitamin D, high quality proteins. Parmigiano Reggiano's cheese can be called as a functional food for the prevention of osteoporosis and bone loss. Such a cheese like the brie and Gouda, they also contain a lot of vitamin K. So together with possibly with supplementation with vitamin D, they can work synergistically in this way. Of course, not every given group of not every region in the world can basically, people from for example, Western Africa or Eastern China, where we can face with the lactose intolerance, they might not just take this product. But of course, the options which is lactose-free or fermented dairy can help in such situation. So once again, here, when we think about like intake of dairy products, we need to be focused on some dairy products which contains less sugar. Don't go for full cream milk just because they contain too much additives. And then also always take in consideration that possibly intake of dairy products with some probiotics in it can work for you even better. This leads us to the exact group of probiotics and prebiotics and their connection with the gut-bone axis, which kind of sounds surprisingly, but the latest evidence data suggests that, gut microbiota, first of all, it affects calcium, magnesium, and vitamin D absorption, which is important. So, and then gut, all those trillions of bacteria, they also not just work for absorption, but when they work in harmony, when they work in eubiosis. So it doesn't provide any risk for the bones. But when there is a gut dysbiosis, when they work not efficiently, it's a risk factor for bone loss. And also at the same time, gut microbiota work kind of as a gatekeeper for inflammation. When there is these dysbiosis, we become a subject for low-grade inflammation, and it doesn't work well for us as the human beings, as the healthy human beings. And the probiotics, for example, like lactobacillus or bifidobacterium strains, they regulate this inflammation and immune signaling and work efficiently in this way. And most of the formulation of probiotics, if we buy them in the supplements, they now may even contain some enzymes for better digestion, or contain prebiotics, which basically it's like we feed with some non-digestible fibers those live bacteria, and that's also support mineral uptake. Now there is emerging data about postbiotics, which are not kind of live, not like live bacteria like probiotics, but rather products of postbacterial work. So it can be short chain fatty acids, or it can be peptides, or it can be even digested cell walls. So it kind of also shows initial, even though in animal data, that also can support the gut bone axis. And all of this agents, whether probiotics, prebiotics, they can work as the synbiotics, we may call them, and they show promise in reducing born turnover markers. And here is the intake. Once again, I would like to say that we just don't need to think about like taking of nutraceuticals on different minerals or anything like by orally, but those guys like probiotics and prebiotics, they can also help us in absorption of these agents, which works for our benefits only. Now, dietary lipids. This is a group of a few fatty acids. So it's either saturated fatty acids, monounsaturated, and polyunsaturated fatty acids. Who are good guys, who are the bad guys here? So let's start with saturated fatty acids. These are mostly fatty acids that come from animal meat diets or high fat diets, and they promote DNA damage in osteoblasts, they promote oxidative stress and osteocyte apoptosis. And they do not just prolong the life of osteoclasts, they also do not give the proper development for osteoblasts. So basically, all these factors definitely leads to increased fragility of the bones. When talking about monounsaturated fatty acids, and here the main sources for them, so it's either avocado or nuts or olive oil, the staple of the Mediterranean diet. So intake of these particular products usually is associated with high BMD, but at the same time we shouldn't forget that some reoccurrence of some of the monounsaturated fatty acids that basically come from the meat are not very good for our health, since possibly they can occur together with saturated fatty acids. And then basically the king and the queen of this group of lipids. This is omega-3. So it's either eicosapentaenoic or docosahexaenoic acid. They all reduce bone resorption. But here comes a little bit of nuance, just because omega-6 acids, especially that's something that happens with the Western diets. For example, arachidonic acid, which when it's taken in excess, it can increase bone resorption. But not all omega-3 acids are bad. So, for example, gamma-linoleic acid, GLA, together with APA, that reduces inflammation via prostaglandins modulation. And here I also need to mention, so the lipid type, of course, and the balance influence and balance of them influence bones remodeling. It's contributes to the prevention of osteoporosis, and even can lead to the certain cell fate decisions when mesenchymal cells can either turn into the adipocytes or can turn the osteoblasts. It's also been shown to be true. And then another molecule, which most of us might think about the circadian rhythm regulator, is melatonin. So it acts on plenty of, while produced in pineal gland at night. So it's basically can work on different, can be targeted into the different cells, where the mesenchymal cells, among them osteoblasts, osteoclasts, and it works through the different pathways. So it's kind of prevents the oxidative stress. I was surprised to find out that it prevents ferroptosis. It's kind of a programmed cellular death, kind of apoptosis, but through that can be promoted through the lipid or iron peroxidation. And it was shown in postmenopausal and diabetic animal models. So basically, what is also important, it seems to improve the mitochondrial health of bone, the mitochondrial health of bone cells, since, and it seems to be, it is important since the mitochondrial dysfunction, it's also one of the causes of the osteoporosis. And also, what is also great, just because it promotes angiogenesis, and it is important to nourish any given tissue without and promote regeneration without any angiogenesis. What is also interesting to that we need to emphasize here, that certain dietary patterns seem to be work not that well for the osteoporosis. So, for example, vegan and vegetarian diets are always, most of the time, they're linked to the lower BMD and high fracture risk. And here we have to educate some patients, of course, especially on when they're on this diets for a long time. So possibly such kind of such group of people with such food preferences that might need to take the calcium or vitamin D supplementation, which will mitigate the risk. It is beneficial for them to do the resistance training, which will improve their skeletal integrity and rigidity in vegans. What was found to be true is that omnivores and pescatarians, they show lower fracture incidence, and intake of Mediterranean diet is strongly correlates with the high BMD in terms of osteoporosis. So nevertheless, knowing that all these groups of molecules, so we need to honestly say that there are certain challenges in nutraceutical research. Why it happens? Since these clinical trials that we've been having so far, we've been learning so far, they have certain inconsistent data. So they may show, they may either show benefits, sometimes they do not. Why does it happen? Because of great heterogeneity in study. Though, and that can be heterogeneity whether in study design or whether it might be like different doses that being used for different groups of people in different parts of the world and different population. It can be different gender-wise, age-wise, and we sometimes do not know what was the menopausal status, like clearly, of all these people. And what is also surprising sometimes, that you know, the challenge is that certain endpoints are different. So whether it was bone mineral density or certain biochemical markers and fracture incidence. Of course, it all depends on the study design, and everyone does it in such a way how the group of researchers want to do it. But at the same time, this lack of standardization, of course, is creates the difficulties in measurement and coming up with the proper approach to any given patient. Also, another problem is high dropout rates, which is obviously, once again, happens in many clinical trials. Why does it happen to particularly these trials? Just because, like, you know, food is one of the easiest pleasure that we have, and sometimes they have to follow some restrict diets, which doesn't usually happens in everyday life, and that's why it doesn't always lead to the clear reports. And at the same time, what is also sometimes can be not beneficial, just because certain researchers they may not fail to report the side effects clearly. It also reflects on nutraceutical research. However, what are the, let's call it a SWOT analysis of nutraceuticals. Let's call what are the strengths of the intake of nutraceuticals. So they're easy to administer, and there is a relatively low side of effects. It is especially important since like there's most of this most of the nutraceuticals have to be taken for a long time, and it's pretty great that sometimes we can combine them. So, for example, like vitamin D and calcium. What are the weaknesses? Contamination risk is one of them. So sometimes we even see it on like on the jar with different kind of supplements and nutraceuticals that we take. So whether that can be some risk of taking what the peanuts or something, or some contamination risk by the pesticides or even heavy metals. Of course, there might be kind of difficulties related to the buying of this product, since they may have high cost. But it depends. Certainly, nutraceuticals are not the most difficult, not the most expensive things on the market. However, there is a market growth anyway, just because people are interested in new options, and the more R&Ds are involved into this market expansion. And it's also create the consumer preference, since people like this kind of complementary therapies. Then at the same time, there is a competition between all those guys who compete between them. So they want to offer their particular products, and not every time the patient, without proper advice, can choose the proper one, the proper product. And at the same time, just because there is the natural products, it is impossible to patent nutraceuticals or natural product. That's why there is not kind of there is no rigorous incentive on developing these particular nutraceuticals, and so it doesn't give us opportunity to use them more in our practice. However, despite the lack of certain evidence and certain weaknesses, we still may follow and use them in our practice. We need to educate patients or people, whoever, our relatives or someone who is facing with the problem of osteopenia or osteoporosis, on the right diets, on possibly on Mediterranean diet, because it seems to be one of the most backgrounded and it's definitely endorsed diet for prevention of osteoporosis. So it has to be full of fruits, vegetables, and proteins. At the same time, we need to emphasize on dairy and for the fermented dairy intake for the people. For those people, for the group of vegans or vegetarians, we need to not forget to remind them, especially when they're a long time on this diet, that they need to supplement themselves with calcium, vitamin D, and possibly with omega-3 as well, just because most of them will have a dry skin. And then at the same time, they should consider probiotics and polyphenol-rich foods, since it also can bring the better shift to the bone formation. And education patients, of course, on risk of restrictive diets is crucial and essential and vital thing. Here, the conclusion, I'd like to say that even though there is a lack of standardization and there are kind of problems in this area, however, and even though it's not a first line based treatment, but nutraceuticals can complement traditional treatments, and they can work synergistically. Of course, it has to be done only when these products are used wisely, and when we provide advice with the proper changing of the lifestyle. So there has to be live core changes, and that is only in such way it can lead to the best results. And evidence-based is still limited. However, we need long-term and efficacy data strong results that will so with the time I believe we are going to have improved trial designs and the standardization required. And I think personalized nutrition is kind of a future. Most of us might use AI or different kind of omics or any kind of different method to create a better nutrition for our patients and groups in the risk in the future. We, as the practitioners and clinicians in the field, we need to strike the best. We need to kind of learn it all. We need to pick up the strongest sides of this beta evidence, avoid it and be cautious to the weaknesses, and then ultimately, by integrating the nutraceutical right approach together with lifestyle changes, it can help us to create the better, friendly, patient-friendly approach, which is led not by the marketing, but only by pure science. Thank you so much.